Why is Duodopa dosage adjustment challenging for Parkinson's disease? Imagine trying to fine-tune a delicate instrument that keeps changing its tune. That's what adjusting Duodopa doses feels like for many people with Parkinson's disease. The reason it's so tricky is because Parkinson's symptoms don't stay the same. As the disease progresses, patients often experience unpredictable changes in their motor control. Sometimes their medication wears off too quickly, causing periods where symptoms return. Other times, they might have too much medication, leading to involuntary movements called dyskinesias. Finding the right balance is essential but complex. Duodopa delivers Levodopa directly into the small intestine through a pump, aiming to provide a steady supply of medication. This continuous infusion helps smooth out the ups and downs seen with oral medications. However, because each person's needs are different, the initial dose must be carefully tailored. Doctors usually start with a small dose and then adjust it based on how well symptoms are controlled. For example, the morning dose is often increased or decreased within small limits after observing the patient's response within the first hour. The goal is to keep symptoms stable without causing side effects. Adjusting the infusion isn't just about changing one number. It involves modifying both the morning bolus dose and the continuous infusion rate. This makes the process more complicated than simply taking pills. Even though Duodopa bypasses stomach absorption issues, individual differences in how the intestines absorb and process Levodopa still matter. Factors like intestinal motility and pharmacokinetics can influence how much medication reaches the brain, requiring ongoing monitoring and adjustments. Side effects also play a big role. Too much Levodopa can cause dyskinesias, hallucinations, or confusion, while too little can lead to persistent off periods. The delivery system itself can have issues, such as tube dislocation or infection, which may interfere with proper dosing. As Parkinson's disease advances, the patient's needs change. Their response to medication may shift due to worsening symptoms or altered drug metabolism, demanding regular reassessment and dose modifications. Clinicians usually make these adjustments by closely watching motor symptoms, listening to patient feedback, and checking for side effects. They often tweak the doses in small steps, sometimes over days or weeks, to find the best fit. This process requires expertise, patience, and frequent clinical visits. It's a balancing act that demands a personalized approach because no two patients are exactly alike. In the end, the challenge of adjusting Duodopa doses lies in the need for precise, flexible, and individualized treatment. Managing a disease that fluctuates so much requires constant vigilance and careful tuning. It's not just about medication but about understanding each person's unique response and making adjustments accordingly. That's why close medical supervision and ongoing evaluation are so vital for successful symptom control in Parkinson's disease. Always consult healthcare professionals for personalized advice and management.